It uses the same technology as photoplethysmography, that is, which I have shown, and it uses the mobile camera. It measures pulse, it measures oxygen, and it measures various other response of the body organs. Then we use the machine learning, AI, and the sophisticated algorithm to derive the response of the body in case of COVID.
Ladies and gentlemen, thank you so much for joining us again on Ask How About. I'm your host, Pranay J. Reddy. Now let's start at the top with some good news. A vaccine, ladies and gentlemen, a vaccine for the coronavirus has been announced, and yes, it's from Russia. So I'm pretty sure you all know this by now. The vaccine is out. But is it really good news though? I mean, I said it was good news, but do approach this work with caution. It is, after all, still the year 2020. Here's the thing. The World Health Organization has not yet announced that vaccine to be in the list of toxic potential vaccines for the virus. Why? Well, that's because the safety guidelines have not been properly released, and also apparently the phase 3 trials had very few number of candidates, and there is no proper measurement of safety or the effectiveness of the vaccine. The virus, as we all know, identification of it has been a big problem. First off, the logistics of it, the number of people we have to test, the number of tests that has to be conducted, and also the money. Let's face it, it's always about the money. The money it costs. Now, the expert we have on today would have probably found a solution to that problem. He has invented, or rather made, a phone app through which you can actually find out if you're an asymptomatic or a symptomatic COVID patient, and it provides guidelines along with the company advice and tell you how to take the next steps. Now, this is a significant advancement, and so that is why we invited him on our show today to talk about how this works and how this potentially could save millions of people and how it could be really crucial in this fight against the pandemic. Dr. Rupam Das.
He is a researcher and entrepreneur. His research areas include robotics perception and fuzzy neuro decision making. He is the CEO of Integrated Ideas and the CEO of Akili Labs Private Limited. He got his doctorate in computer science from DTU Belgaum, India. He has approximately 14 research publications and numerous honors and awards to his name. So that's a bit about our guest. Let's get on with the show.
Dr. Rupam Das, thank you so much for joining us today. I'm so glad you could make it. It's really a pleasure to have this conversation with you.
Thank you. Thank you, Pranay. Privileged to be part of your channel and privileged to be talking to you. Looking forward to have a great discussion with you, great conversation with you.
So, thank you for saying such kind words, sir. It's an honor from our side to have you on our show. And so we'll get straight into it. So first, I want to know your take on what's been transpiring over the past 6 months or 5 months about this pandemic and how the situation is right now.
Okay, so we can divide the pandemic quickly into a few things. First, the socio-economic effect. The second thing is biological effect, obviously. And the third thing is the effect on overall humans in terms of their psychology. So first of all, the biological effect, as we have already seen and as we discussed earlier also, COVID is a very pandemic, very contagious virus, but it's not a very lethal virus. The amount of death has been lesser than the amount of death that generally we see due to common cough and cold and flu and influenza. So in that regard, it is not as deadly as it was thought out to be. However, the response has been extremely harsh, particularly on the small entrepreneurs and particularly for a country like India, where most of the economy is unorganized economy and where the small entrepreneurs find entrepreneurship as the way of changing their financial status or class per se. So in that regard, it has been very devastating. Number of deaths due to hunger is going to be much more than number of deaths due to the pandemic. And the third, the biological as well as the mental effect. It is humans are not lonely animals. Humans are social animals. Touch, hug, laughing together, crying together, taking time out together is essential part of human biology as well as the gene. The lockdown has severely affected the psychology of people. Depression and anxiety has been on the rise, and there is not going to be any alteration in this situation anytime sooner, because now that anxiety and depression is also been amplified by the economic and the financial boost. So all in all, I would say that if I have to give an anecdote, I see pandemic as a microscope to show an ant as an elephant.
So your take is while the virus in and of itself is not that big of, it's not that deadly, but the effect of the pandemic is more deadly than the virus. Again, that's
Absolutely. Absolutely.
So then talking about the virus and then talking about how we can combat this, one of the key steps is identification, or rather figuring out who's been infected and who's not. And so far we have, I guess, 80 million cases across the world, and the worst part is almost 70% of the people are asymptomatic. So we don't know it. The cases might be much, much more than just the reported ones. So in that way, you have made a device which can now identify who have been infected and who have not, using a mobile app, if I'm not mistaken. So how does that work? Take us through that process.
Okay. So first of all, there are two types of changes that happens in the body. One is a structural change, one is a functional change. Whenever there is any virus or any bacteria or any disease for that matter in the body. A structural change, for example, you've lost your eyes. That's a structural change. A certain structure or anatomy of an organ or a system doesn't work well. That's what we call a structural change. What is a functional change? Human body keeps on changing every second, every minute to respond. So for example, you see certainly somebody throwing stones towards you, so your body will immediately generate a reflex response, and there will be hormonal changes, there will be chemical changes. This is what we call the functional changes. Now, so these are the two different ways of diagnosing if there is any problem in your body or not. So currently the focus has been to again the structural changes like RT-PCR test. When the virus goes in, there is a viral load. We take a nasal or the oral swab and we try to detect whether there are viral particles or not. However, as you yourself have said, that the virus is not the problem because the mortality is very, very low. That's in India, it's about 2%. So even if we detect somebody has got, let's say, COVID, that detection doesn't really make any sense in terms of the clinical, in terms of the way the clinician should act. Now, when the virus goes into the body has got two immunity layers. First is called the innate immunity, which is your first layer of defense, which is mostly the good bacteria that are present in your body. So this good bacteria fight against the virus and tries to throw them out. That's why whenever an external body enters, you sneeze. So sneezing is a good thing. So which means that you have got good bacteria which are fighting against any external body and sending them out. So then it goes to the next stage. When this bacteria, the good healthy bacteria, fails to defend your body, the next stage is the adaptive immunity. Now, adaptive immunity is controlled again by various different organs. So liver contributes towards this. The blood, liver is a major police source. So again, in anecdotal sense, you have the paramilitary forces, you have the police forces, you have the military forces, heavy artillery. So in this way, different layers are there in our immunity layer, which is when the virus, the adaptive immunity kicks in when the virus actually starts spreading or it starts multiplying and then going towards multiple organs. Right. Now we have seen there is only 2% mortality. Now, detecting whether you are COVID or not doesn't make any sense because that detection doesn't tell me whether you are going to be part of that 2% or not. So that's a very, very small number to make any sense, right? Now, we cannot administer you with the medicine, because if you are not supposed to get too ill, giving you medicine will damage more than the COVID will damage, because your body is anyways fighting with that. The second challenge that we face is with the finances. Now, essentially, on an average, a RT-PCR test costs you about 4,500. Multiply that with 140 crore population. Now, even if you are to screen, even if you are doing 1 lakh tests a day, to give you the audacity of this problem, if you do 1 lakh tests a day, it is going to take 35 years to screen the entire population of today. If you do the number, okay. And if you want to screen the entire population just once, you are going to spend 16% of your GDP. Now you are not going to do that. You are going to test twice. So we are talking about 32% of your GDP going into the testing the entire population, which is not feasible, right? And after the economic breakdown, lockdown, breakdown, whatever you want to call it, we have a condition where people are deprived of their food and basic employment. And to expect such people to spend such money on their testing is unreliable. So we sat across and we thought, why can't we use the age-old technique? Because pandemic occurred 2000 years back also. And if you read the history of pandemic, India has been the least affected country in the pandemic, other than 1919 flu, where the Indian population suffered mainly because the food was deprived to them, and mainly there was a colonial rule. Other than that, historically, India has never suffered in any pandemic. Yes, there have been epidemics here and there have been deaths, but not a mass extinction like your Black Death or like Japan smallpox. Now, so we sat across and we thought that what is the reason why India is being least affected by the pandemic historically? A country like England, 1600, if you see 1700, they have been constantly hit by various pandemics, wiping out a lot of population. And why that hasn't happened with India? Because when we look into Indian medicine structure starting from Sushruta, it has always been functional medicine. It has always been physiology driven. It has always seen the body not as a machine, as the current pathology driven test does. It has seen the body as a constantly changing system. Okay, and all the diagnoses, the fundamental principle of whether it is Ayurveda or all the traditional Indian medicines like Siddha, which is a very age-old Tamil medicine, is based on that same prospect that we don't see diabetic as a disease, or rather the traditional Indian medicine or the functional medicine doesn't see virus as a virus or bacteria as a bacteria or fever as a fever. It looks into what it does to the body, what it does to liver, what it does to eyes, what it does to your heart, what it does to your legs. So how each of these organs get affected by different kind of diseases or the situations, and then it holistically tries to address them. So we did the same thing. Now, there is a device called photoplethysmograph, which is being continuously used. So this is one of the device which is currently being used, which gives you the heart rate and the SpO2. Okay. Now SpO2 gives the saturated oxygen. So in case there is a respiratory tract disorder, your SpO2 gets lower. So as you can see, I do not know whether you are able to see or not.
So that shows how much saturated oxygen is in your blood.
Yeah. Yeah. So now if somebody's lungs is affected, this saturated oxygen will come down, and then we have something like the temperature sensor, which has been currently used beyond RT-PCR everywhere. These are the two things which is being used. So we have this temperature measurement device which you take. It is going to the IR temperature. It is going to show you the current temperature, right? So these are the two things which are being used for the monitoring purpose. Now, you see, the problem is that fever can be due to many different facts. You may have cough and cold, you may have other conditions like inflammation due to which you may have a fever. So fever doesn't tell you anything. If you go to WHO site clearly says that high fever doesn't mean you have a COVID. Many of the COVID asymptomatic patients are found to have no fever. Because they are asymptomatic, the lungs are still intact, so there is no change in the SpO2. So in a sense, whatever you are using at this moment, theoretically and even as per WHO doesn't work for most of the COVID cases. They are asymptomatic cases. Now the problem actually doesn't stop there. The next problem is that even if you are asymptomatic, you are still a carrier.
Right.
Even though small, you are still a carrier. Now, if you go to home where there is an immunocompromised person, the immunocompromised person is not only BP, diabetes, somebody with extremely high anxiety, somebody with extremely, who is having hemoglobin deficiency, somebody who may be having liver failure, somebody who may be having, kidney disease. It may be anything, anything where they are already immunocompromised. So if somebody is immunocompromised, in that cases, you go to home and you'll be spreading it. Even with a small viral load, they are going to keep developing that, right? The problem is SpO2 is going to show you, the SpO2 is going to show you a change only when you actually get symptomatic. The problem is once you get symptomatic, you have no way to know whether you will be living or not because there is no medicine to it. So everything is on the chance. Okay, so we have this peculiar, we have this very peculiar problem. Number one problem is too many years will be taken for the screening entire population. Too much percentage of GDP would be gone over there. Even if it is detected, that has got no clinical relevance. For those patients who doesn't go symptomatic, they do not know how much they are spreading and to what effect this is going to have on the other people. The antibody is not a proof that you are not going to go symptomatic. Not having an antibody also doesn't mean that you are not going to be dying. So it's a peculiar condition where nobody knows, the case. So we thought, why can't we use the India's 2000-year-old practice and with some modern technology to provide the country something which has helped the country to fight against any pandemic for a long period of time.
What exactly is the process on how it happens? So you've explained so far about how the pandemics affected us and also why we Indians are not so prone to pandemics in the history. So you're using a technology, or rather, let's say a practice from before and a technology of right now and combining them together to bring this identification device. But what exactly is the process by which it happens?
It uses the same technology as photoplethysmography, that is, which I have shown, and it uses the mobile camera. And then
So you placing the finger on the camera, it becomes reddish in color. So it measures how much.
It measures pulse, it measures oxygen, and it measures various other response of the body organs. Then we use the machine learning, AI, and the sophisticated algorithm to derive the response of the body in case of COVID, and in case of other viral diseases such as influenza, then your common cough and cold, and so on and so forth. So once we do that, now why India is protected is, has been protected historically, is once people started identifying the changes that somebody might have been infected, people started isolating them. So social isolation is something which is being started by India, right? So you isolate people such that the other set of people are least affected by them. And then that social isolation later on got got into extremely bad shape, but let us not go into that in depth. But what we understood is Indians were good, traditionally Indian physicians were good to early detect what is the likelihood of certain group or person to become infected and spread that infection, and they socially isolated them, right? So we use the same technique. Let's say today you know that, okay, I have a very high risk of COVID, through our mobile application. Then you isolate yourself in your home, and then you follow a traditional Indian protocol which is being used for last 2000 years. So we have built a home protocol which doesn't require any medicine. So you stay back in your home, you take care of yourself, and you get over that, and you are able to monitor every hour by hour. But in the case of, even in the case of RT-PCR, you actually do not know what is going on inside your body, because the incubation time of the virus is 4 to 14 days.
Right.
So even if you go to hospital, you do not know what is your probability of surviving. You'll come to know only after 14 days. So the anxiety up to that 14 days will already make you immunocompromised. Okay. Because you are already constantly thinking, what am I going to go through? Can I survive? Can I not survive? Now imagine that you can now, every hourly basis, you can see what is my progression, and getting the confidence that yes, my overall health is increasing. Can you do an hourly RT-PCR test, or forget hourly? Can you do a daily RT-PCR test? Is that even possible? It's not possible, right? Right. No matter whomsoever it is, once you know that you have got a deadly virus and 14 days you are not going to know anything, it breaks your psyche like anything. And then if you are put into isolation, people discriminating with you, or people putting you in, let's say, quarantine center or even home quarantine, you are already isolated. I told you the first theory, that humans are social animals. So you are already being socially isolated. You are constantly thinking what is going to happen after 14 days. That is going to break you like anything. Even if you get over COVID, you are not going to get over this trauma for very soon.
So I clearly see that psychological effect is much more harsh on a person than the actual virus, like we discussed even earlier. But what does the, so I see that the app is not just an identification app. It also helps people, understand, or rather, even take part in the protocol. So do explain and go through the process of that.
So what we have realized from the early stages of COVID is, we did our first clinical trial in Medanta, second phase 2 trial also just completed in Medanta, and we have extended the clinical trials sites. We are doing it in South Indian locations also, and we have supported almost 1723 patients, out of which we could not save one life, but rest, we have saved all the other lives. In fact, also the symptomatic patients, with the help of our clinical team and Medanta as the primary primary hospital partner. Now, what we observed is that in the asymptomatic stages, even somebody with hypertension or diabetes can completely recover if they can take certain cares. Say, for example, they isolate themselves, they reduce the amount of food intake, sugar intake, they reduce the amount of interaction with people, they get exposed to sun and things like that. So we have built a comprehensive protocol based on the home monitoring, which has helped now over 1,000 people. So all it does is it gives you the step-by-step thing of what you need to do, and at the same time it helps you to keep monitoring. So not only you are following a protocol, but you also know by yourself whether I am improving or not, because in the asymptomatic phase you may have one day of fever, you do not have continuous fever. You may have one day of cough and cold, but that 14 days, it's like a mystery for you. But life is, because it's a physiology, every hour that your body is changing, it is going to show you that these are the changes in the body. Now, when you know that no, even after following this home protocol, there is no improvement in my health, and it is showing that it is constantly going down, that is the time when you have to have the clinical intervention. Even in that case, you are reaching to the doctor much earlier than the other symptomatic patients, right? So that's how we are helping you. We are helping you to reduce your CPTSD. We are helping the government to prioritize the queue. We are helping we are helping the asymptomatic cases to take care of themselves and also know which direction it is going. And also at the same time, we are helping you to reach to the clinical help much earlier in case you are going towards symptomatic.
So for all the viewers out there, can you just say the name of the app and how they can get
Lifeus, it is called Lifeus, Lyfas, and this has been now supported by Government of India DST, and we have been virtually incubated in IIT Chennai, IIT Chennai Health Tech Incubator. We are also being supported by Government of Karnataka startup grant. We got Elevate grant in 2018, so we have been supported by Government of Karnataka as well as Government of India. We have been CE certified, and we are also ISO Med certified. It is not available in the App Store, but you can always reach out to our LinkedIn our LinkedIn page of aculilabs.com, and you can always have us incorporated into. I mean, whenever you have doubts that you might have a COVID, you can search Aculi Labs Private Limited. You could go to LinkedIn and you can ping us, and we'll reach out to you, and our medical team is going to support you in case you doubt that there could be an infection. And we are expecting us to be in the public domain in the last week of September.
So for all the viewers out there watching this, as of right now, we'll post all the links that Sir just mentioned. So please do contact them if you think you are getting infected, or rather even if somebody you know is in that peculiar situation, or just take a look to understand, because it really is cutting edge science, guys. So one last thing I'd like to ask you is, where do you think, or rather, what do you think the future in the next few months could be like? How do you think things would shape up in the next few months?
This pandemic is going to last for another 2 years. The history suggests that any pandemic stops after it affects 50% of the human population. So even though viruses do not have a brain, they seems to be very clever. They do not want to eliminate the entire population, then they don't have any host to live on to. So if we look into the history, we see that any pandemic stops after the virus has affected 50% of the human population. That is, we are talking about around 3.5 billion of population getting affected, and some population will be getting the antibodies, which will spread through herd immunity. So I am looking at 18 to 24 months of time period till which this pandemic is going to last. There is nothing to be worried about. 2% mortality rate is nothing. I mean, we have more deaths due to accidents in places like Bangalore. So this is just something which you don't have to really be worried about. You get infected. I mean, we have treated a lot of patients, so I can tell you from my experience of handling with the patients that it's really blown out of proportion.
So one thing I took away from this interview is that the psychological effect is much more severe on us rather than what the virus actually does to us. So on a whole, the pandemic is deadly, but it's not necessarily for the reasons one might conceive it to be. And so one last thing I want to ask you is, or rather tell you, is that your app is a great initiative, sir, and I really hope more people get to use it, and I really hope that it helps and prevents a lot of people from actually getting affected due to this pandemic. So for all the viewers,
even if you do get affected, don't worry, we'll take you out. Our response has been extremely good. Our Indian doctors have been super good in this pandemic. Yes, there are some cases here or there. There are some sporadic cases, but hats off to our clinical team, ground staff. They have been brilliant. I mean, really salute to each one of them.
Right, seriously, for all the doctors, and I did this in an episode before as well. I really appreciate all the efforts they're putting in first, because they're the frontline workers of this battle. So, and you're also part of that battle, sir. And so I thank you for coming up with such an initiative to help so many people, across our country. So thank you, sir. This is what I'm saying. Thank you for being on the show. Thank you for taking the time to be on the show.
Thanks, Pranay. It has been a great having a conversation with you, answering your question. I wish all the best to your channel and all the best to your viewers. Stay safe, spread smile, live happily, pandemic or no pandemic, just be leading a very happy life. Thank you.
Well, that's wonderful advice. So thank you, sir. Thank you so much. Now that concludes the interview. Now, as you've seen with the interview, Dr. Rupam Das is more concerned with the psychological effect, and which is fair to say because the mortality rate is not actually that high. The common flu has a higher or similar mortality rate in some countries. Now that is saying something about this virus. So then you might be thinking, why do we have to be so cautious? Well, for the simple fact, as discussed in the interview, it's very contagious. All the precautions taken are necessary. We still have to be hygienic. We still have to maintain some boundaries and some protocols to ensure we can combat this virus. But again, as Dr. Rupam said, it's important to keep our psychological morale, or rather for just to be happy to have some sense of normalcy. So with that, I'd like to say, please make sure you're safe, and please do check out the links below so that you can maybe potentially help a person infected or rather who seems to have COVID-like symptoms. So that concludes this episode, and I hope you liked it. I hope you found it informative, and I hope it really contributed or maybe made an effort in you finding out or rather finding ways to help a person in combating the virus. So thank you so much for watching, and please do like, share and subscribe. Now that is a really big help for us. Thank you for watching.